Hi everyone, I'm Brian from the Smart Health Leadership Center at NUS ISS. So together with Wai Kin and Lin Hui, today we would be exploring what are some of the digital transformation that have been accelerated by COVID-19. So we are from the Smart Health Leadership Center that was established in 2015 with a vision to transform future experience of health through data, technology, and innovation. So we enable this by running trainings, doing research in this area, and as well as having consulting with the industry. So in the past 9 months since late December, early January, COVID has been sweeping through the entire world, right? It started off in China and it started to spread everywhere. So since then till now, we have more than 20 million cases of COVID internationally. And the numbers are still rising. So unfortunately, with this, under such circumstances, it has really pushed us at our boundaries to see what else can we do in order to cope with this situation digitally, and as well as how do we then continue with life as we would want to. So COVID, we know that it spreads from person to person, and once someone is being affected, they might just have really mild symptoms, such as cough, fever, sore throat, and things like that. So, and because of this nature, it's not easy to detect it, not like previous pandemics that we have had. And with that, it's much harder for us to identify people and control the spread of this disease. And definitely has got a profound impact in terms of work and social life for us. We have started stay-home notice and quarantine orders. I myself was quarantined for 2 weeks because I visited a gym that was visited by someone that was infectious. For many months, we were working from home, and only recently have we started going back to our workplace. So in terms of work and how we interact with people, it has profoundly been impacted. And why do we want to have the social distancing measures in order to avoid crowds? Is really to protect the vulnerable people that are in the community, such as the seniors that may be living with us. Or also, we also need to protect our doctors, our nurses who are serving us from hospitals and clinics every day to keep this COVID-19 at bay. We also need to be mindful of our workers that are unable to stop work at this point because they need to keep the supply chains going, or the gig workers that if they stop, they have got no more income, right? So these are some of the people that are vulnerable that we need to be aware of and try to protect them through these measures. So COVID has really been an unexpected catalyst for change, right? So how have we been managing this is through social distancing measures. You can see that everywhere now in every food court that we go to. Similarly, in the healthcare sector, we are also adjusting and coping with this. So we are coming up with better ways to protect our healthcare workers. Imagine that you have to wear a mask all the time throughout your entire 8-hour workday. It is really quite a fatigue for them. So maybe we'd like to throw this question out to everyone that's attending right now. What are some technology or digital solutions you have adopted in the past few months in order to cope with or manage COVID-19? May it be staying safe, or may it be to keep mentally active or physically active? What are some digital solutions you have been adopting? Please scan the QR code or go to pollev.com and enter ISS 2020. You can see some of your responses over here. Great. So I do see meetings, Zoom. Yeah, Zoom is kind of like my best friend now. I'm always on Zoom. I go in Zoom like 6 hours out of 8 hours. So yeah, I think that's something that we really rely upon in order to continue with work, right? In order to meet people. Trace Together, yes. So Trace Together is something that really helps with the contact tracing efforts from the government. Yeah, so it works by Bluetooth, right? So no real-time information is collected. Only when you are ill, when you go in and they really detect that you have COVID-19, will the information be taken out. Yoga, yes. So I also have been doing yoga online with my spouse, with the rest of our friends. I didn't do yoga before this actually, but it so happened that it's easy, an easy sport to do online. So I think that has also a profound change for me. Netflix, yeah, how we take to spend our time in the evenings. Fitness classes, yeah, house party. Oh, that's a good one. Yeah, I think amongst my friends, we do that. Well, for a start, at least playing games. So in terms of tackling the challenges from the government, and I think for sure all of you guys know what safe entry is, and I hope that you have been using safe entry every time you go into a different place. That really helps with contact tracing efforts. Trace Together as well, there's something has been implemented quite early. And now we are also moving into the physical device for seniors who are perhaps more isolated or are not on any of these devices. So the government are giving them out these little Bluetooth beacons that basically will not need any charging, and you can basically carry this around with you. And if you're ill, this beacon will be collected by the government, and you'll be able to know who are some of the people you might have interacted with over time. We have also put in place some wearable devices for stay-home notice people. We know that sooner or later we'll need to open our borders and welcome more people in. That's just for the sake of the economy to move forward. That has to take place. So there's more of a preemptive solution that we're putting up. Right? So they have to wear a wearable, and they have also put in this socket within the house that the room that they're in order to make sure that they're staying at the same place for the stay-home notice. Other trends that we are seeing at this point in time is also an increased adoption for telehealth services. Previously in Singapore, we already have services such as white coats, doctors anywhere. So these are some teleconsult services where you can go online and have a chat with your primary care provider and have a simple diagnosis, right? These solutions in Singapore previously was not so well known, or rather quite contained with a certain group of people that preferred early adopters to this. But what we see, international trend from WHO is that not only in Singapore, but everywhere else around the world, telehealth is on the rise, right? In terms of, similar services to white coat, I would say, right? To go online for a consult. Or tele-rehab services is also something that we see. In fact, we also see Chinese medicine also starting to adopt this kind of a model. Yuan Sheng is also one of the companies in Singapore that's exploring telehealth Chinese medicine doctors to do the services online. Other than this, in the health space, we also rightfully like what you guys have said, right? Yoga classes online. We see that a lot of gyms are unable to operate the normal way that they do. So they are continuously transiting online. So not only yoga, HIIT, high intensity training, so they are also going online as well. At the same time, we also witnessed an absolute nationwide sellout of Nintendo Fit Rings. So gamification for fitness and workouts is also something that we can expect to be on the rise, especially nowadays where you might not feel so safe going to a shared gym with multiple people that you've never met before. Can I do it at home? So these are some of the solutions that people are adopting. Socially, we are also meeting online more, especially true for the younger folks where they are no longer able to meet their friends in class or after school. They are meeting online these days, for example, in Animal Crossing. I can see some of my colleagues here are also adopters of that. I believe that they have started to design a Sentosa in Animal Crossing, right? So you can go into Sentosa and hang out with your friends online. Imagine that. So that is some things that the youths are doing right now. We also see that same trend for our seniors. My parents have been meeting long-lost friends that are all over the world right now on Zoom, and they do that every Friday evening, right? Have a Zoom chat together with all their friends, their kopi kakis that they're no longer able to meet face-to-face. They do it online now. In the social domain as well, we see that there's a rise in mental health issues in the past few months, especially during the circuit breaker periods. There's a sharp increase in terms of, say, domestic issues and also mental health issues where people are losing their jobs and have nobody to speak with about that. So we do see a lot of mental health and social services, counseling services moving online as well. And so you can now go get this kind of consulting services from a lot of the social service agencies just via Zoom, right? Other interesting initiatives that we see, such as happiness initiatives, that they have a mental resilience series that ran throughout the entire circuit breaker period, bringing in young and old people to talk about, what can we do to stay mentally resilient throughout the COVID period. Some people shared about their failed businesses. Some people shared about the relationships that they had at home, and how are they really keeping resilient and staying strong throughout this entire period. So you can check them out on their website. I believe they still have got a lot of other talks that are going on right now. And these are really purely out of a voluntary basis, right? People just logging into Zoom and have a chat about these things. Previously, having such conversations is not so easy, but through COVID and through digital transformation, adopting more and more people adopting things like Zoom, this has become a possible solution for social care for the future. At the same time, we also see developers in Singapore exploring new things, such as good hoods, right? So this was developed by a Singaporean, thinking about how can we create that neighborliness among our neighborhoods, among our communities. How do we get people to help one another throughout this period? There are many seniors who might be living alone at home that would need some help. Who can be the people that can help them? Well, one person could be the neighbor, right? So Good Hood is really a platform where you can go up there and put up something that says, hey guys, I can help you in doing this, or I have got some items I would like to give out and share with everyone. You can do that. Or you can also go up there and say that, I've got a certain need in this. Can anybody come in and help me? So yeah, do check out the Good Hood, Good Hood SG, quite an interesting platform that arose from the COVID situation. So these are some of the trends that we see happening almost immediately as COVID took place over the circuit breaker period. I would like to hand the time over to Lin Hui right now to talk a little bit more about digital transformation. And later on, Wai Kin will talk more about the trends for the future. So Lin Hui, please.
Okay, thank you, Brian. Okay, hi everyone, I'm Lin Hui. So what exactly is digital transformation in the health and social care space? Okay, so essentially digital transformation is the integration of digital technology in all aspects of how a health or social organization interacts and creates value for patients and the beneficiaries. Okay, a common misconception with digital transformation because of the word digital is that, we may think that, it's all about the technology. Answer is, it is not. Okay, basically, if we are talking about just the technology itself, it's something what we call IT transformation, which I will go through later on in the next few slides. But for digital transformation itself, it's really all about connecting the dots. Okay, connecting the dots with what your user needs or want to the business model or process in your company, and then finally to the new or existing technology that can offer some form of value to your users as well as to your company. Okay, successful digital transformation essentially happens when a company is able to connect all of these dots and create something that is usable and something that your users will actually want to pay for. Okay, and especially for the health and social domain, it is this is a concept that is especially important because of the fact that for these two industries, it's all about it's still very much all about human interactions. So basically, when it comes to bringing in a new technology, we need to make sure that all this digital solution needs to be easily used by all the users, especially for those less tech-savvy ones. Okay, so I'll use thermometer as an example to bring you through what I'm talking about. Okay, so over here you see that on the left we have the traditional thermometer. So essentially the use of this traditional thermometer can be a bit cumbersome because of the fact that it does take a while for you to measure the temperature, and somehow or rather you need to always be very, very careful not to break the mercury cap at the bottom of the thermometer. Okay, so in the last 10 years, we have developed digital thermometers where we can now take the temperature from the surface of your skin, and it almost instantly measures your overall body temperature. So more or less, the digital thermometer has, kind of resolved a lot of the handling issues when it comes to the traditional thermometers, right? However, it hasn't really addressed most of the issues with the user side. Okay, why do I say that? When we measure temperature, what we want is, we want this to be more of a continuous process, so as to ascertain and confirm whether or not we are running a fever or not. Okay, so recently, the newer innovations that has come into the market will be something like what you see on the right over here with the baby. It's something called a thermal patch, where it's just pasted onto, the body, and then it continuously measure the temperature and uploads this information to a platform, which in this case is the phone, where you can then track its changes over time. Okay, so the transition from the digital thermometer to the the thermal patch is what we usually use as an example of a digital transformation, because it now starts to take into account the usability and the experience of the users using that product. Okay, if we talk about IT transformation, mainly we are looking at how the transition between from the traditional thermometer to the digital one. Okay, so here's a comparison between these two concepts. Okay, for IT transformation, again, it's the misconception that I talk about. Okay, and it's something that's very easy to understand because it's really just all about the IT technology and priorities. So for IT transformation, it's just really all about upgrading or changing certain parts of the organization's IT system. Okay, with a very clear end state in mind, sort of like buying something that's off the shelf, you plug it into your IT architecture, and then you try to use it. Maybe modify things here a bit here and there. Okay, but I would say that for IT transformation, it has to comes first. You basically have to have that technology in before then you can say, you can start doing your digital transformation. Okay, for digital transformation, it's powered by IT, yes. Okay, but the driver for this transformation is from the users. Okay, essentially, users' preferences and behavior is what would drive the decisions taken by these organizations on how to even use the technology or even adopt it in the first place. So while IT transformation has a clear end state, digital transformation is an ongoing process and basically takes into account changes with your users, and then and then companies will have to learn how to deal with it and with these changes over time. So all in all, without this focus on on your users, usually IT transformation would end up focusing more on managing the tactical goals, such as reducing costs, reducing risk, okay, rather than actually creating actual value for your users, which is mainly what we want, right? Okay, so in order to drive digital transformation, we have a roadmap, okay? And here's an example. So in order to kickstart this whole transformation process, we look inwards first. You have to understand what exactly is your company all about. What's the business model? What exactly do you want to offer to your users? Okay, second step is to then, spend a bit of time understanding what are the pains and gains of your users. Okay, and then with this tool in mind, only then, should you then look around and see what are the existing or new technologies out there that could create the value for your users. Okay, and with part of the consideration, you have also, to take note of what are the external factors. Okay, because we're all living in an ecosystem, you need to take into account, what might be happening in the, political space, or in this case, how the COVID-19 pandemic has changed our lives. Okay, and that's with all this in mind, and that's where proceed then to draw out what's the game plan in order to drive the transformation forward with your organization. Okay, so now I'll hand over my time to Wai Kin, who will then bring you through some very exciting examples of digital transformation in the health and social care space. Okay.
Thanks, Lin Hui. I'm Wai Kin. Next, I'm going to share about the example for digital transformation. Areas to be covered will be, there are artificial intelligence, blockchain technology, and Internet of Things. First, let's look into artificial intelligence. How artificial intelligence helps in clinical information. So there's a startup company in Singapore called Bot and AI, BotMD, which developed a clinical chat assistant mobile application to help doctors and frontline healthcare workers to get the latest information relating to the COVID-19. The apps has been using in NUH and Tan Tock Seng Hospital. So they use AI to power natural language interface and to extract the clinical information from different data sources. Next, we will see an interview on how this project relates to.
During the COVID-19 pandemic, doctors and nurses need to react quickly. And now, as Isabel Lim finds out, some of them are getting answers quickly by just messaging an AI chatbot instead of trawling through documents.
Information at your fingertips. That's what healthcare professionals like Dr. Jen need. With the COVID-19 pandemic raging on and patients coming through the doors of hospitals, time is of the essence.
The number of computer terminals that we have available for people to use is limited, and the computer terminals are the only things that are connected to the intranet. Our mobile devices aren't. So if we want to look for people to call, we have to get to one of those computer terminals, look through dozens of call rosters to try and find who we want to contact. Sometimes the information is there, sometimes it's not, sometimes it's wrong, and it can waste up to 10 to 20 minutes.
A new artificial intelligence messaging app, however, aims to speed things up. Doctors can type in their questions and receive a reply with the relevant information instantaneously. For the National University Hospital, this could mean information like standard operating procedures in an emergency, aside from who's on duty, and drug-related information. And as Dr. Jen says, she gets this information quickly and accurately 95% of the time through the messaging app. Over 500 NUH healthcare professionals have been piloting the messaging app so far, and plans are in place to extend it to more than 3,000 frontline medical staff in other hospitals, such as the Ng Teng Fong General Hospital and Alexandra Hospital by the third quarter this year.
As you can see from the previous video, the mobile application really helps to save the time for the doctors to find out all the related information. So next, we will look into the artificial intelligence using in precision diagnostic. So in China, Philips partnered with Sunku Technology to develop an AI algorithm that can quickly characterize the affected region of the lung based on the CT scans. Besides that, the algorithm also helps to analyze the patient's scans over time, and it enables the physicians to track the disease progression and to decide whether they allow the patient to discharge from the hospital or not. Artificial intelligence also helps in drug discovery. So a startup from UK, they use AI drugs discovery platform to identify the drugs that can disrupt the viral entry pathway of the COVID-19, and reducing more than 370 candidates to 6 that show the most promise in just 3 days. Google DeepMind also using the AI technology to predict the structure of the 6 proteins associated with the COVID-19, and this will help in the research and also developing the vaccine. Next, I will cover the blockchain technology. Although blockchain technology has been in the market for a while, but the adoption rate is still low. With this COVID-19, this might speed out the adoption rate. So what is an electronic health record? It is a digital copy of an individual medical record. It is typically maintained by the healthcare provider throughout a patient treatment. So blockchain technology step in to reform the interoperability of healthcare databases and providing the increased access to the patient medical records. With this, the healthcare provider and also the hospital no longer need a specific software or databases to access the patient data. Okay, next we will see another video related to the blockchain technology.
In our world today, with the technology available, could healthcare be better? Today, doctors, nurses, and health professionals are limited in the level of care they can provide. This is due to the inability to view your complete and accurate health record.
At Medical Chain, we believe that by putting patients at the heart of healthcare, we can truly improve people's lives.
With Medical Chain, You have full access and control over your own personal health data. Users are able to grant doctors immediate access to their health record via their mobile device. Medical Chain keeps electronic health records safe and secure using blockchain technology. The blockchain layer of Medical Chain hosts limited, non-personal information. This information acts as a pointer, directing the system to your encrypted health record. Encrypted records are held within hospitals, universities, and non-profit organizations regulated to handle sensitive data. Only your authorization can unlock your health record and allow it to be viewed on the mobile interface. But Medical Chain is much more than a way to view patient electronic health records. Services such as telemedicine consultations are available with Medical Chain. Your doctor can check your progress with access to your medical history. Wearables ensure that doctors can access life-saving information when managing vulnerable or unconscious patients. Medical Chain provides peace of mind. You can feel safe knowing your health data is accessible to you and your doctor when it matters most.
Blockchain technology really helps the patient to share their data to the doctors in a very secure way. Besides that, blockchain technology also can help in supply chains. There are many counterfeit medicines in the market, and blockchain technology helps to reduce fraud and to manage better quality in the manufacturing and distribution of the pharmaceutical products. How it works is the drug can be tagged with barcode or RFID tags, and once they are scanned, the records will be kept in a blockchain, and this record will be outdated in real time as a drug transfer from one entity to another entity in the supply chain. So patient or authorized parties can check the records anytime. Next, I will go into the Internet of Things. So let's look at one example. In hospital, nurses need to take the measurement of temperature, heart rate, and also the blood pressure from each patient every 4 hours. So to reduce the workload from nurses, we can use a wearable or a patch to continuously monitor this measurement and alerts the nurses when abnormality happens. Some research also found out that by continuously monitoring, this will help the physician to find out more valuable insight and allow the physician to provide personalized treatment and improvement and improve the patient outcome. Next, we will look at another video which related to the Internet of Things.
Caregivers can have a new way to keep a closer watch on patients on general care floors and in ED waiting areas in need of more frequent monitoring, using wearable biosensor technology from Philips. Worn on the chest, this discreet, lightweight biosensor provides the ability to wirelessly monitor vital signs, posture, activity, and detect falls automatically and frequently. The single patient use biosensor offers a broad range of continuous measurements, while giving patients enhanced comfort and mobility. Patient data is sent to the Philips IntelliView Guardian solution, which analyzes the combined trend of the measurements and updates the patient's EMR. For hospitals feeling the strain of limited staff, the wearable biosensor and IntelliView Guardian solution provide your nurses peace of mind in the hours that pass between spot checks. If the system indicates that a significant change or deterioration is occurring, an actionable notification is sent to the care team to mobilize early intervention. This advancement in patient monitoring technology can help your hospital realize the benefits of fewer complications and returns to the ICU, along with enhanced clinician workflow, length of stay management, and patient care. The Philips Wearable Biosensor and IntelliView Guardian solution. Keep watch and intervene early.
Okay, as you can see from the video, the wearable is very helpful for the doctor and nurses. So next, in the next example, we will see how the Internet of Things help in asset tracking and control. So IoT devices tagged with sensors can be used for tracking real-time location of medical equipment such as wheelchair, oxygen pumps, and other monitoring equipment. Normally, these equipments are scattered around all the vicinity of the hospital. Besides that, IoT also can help to check the deployment of medical staff at different locations. IoT devices can also help in assets management, such as pharmacy inventory control and also the environmental monitoring. So as a summary, COVID-19 has sped up the transformation in healthcare, and digital transformation is not just about implementing a new technology, it's about a strategy and new ways of thinking with our user in mind. Okay. Just for your information, Smart Health Leadership offers professional diploma, which cover in design, transformation, data, technology, as well as system thinking and root cause analysis. You can surf our website for more information. Okay, next I will invite Brian and Lin Hui back to the stage for the Q&A session.
Okay, great. So I think we already have some questions that came in. One of them was on blockchain. So I guess maybe why can you want to take this? Can blockchain track the expired date of medication? As I've seen, many drug shops are selling expired medicine.
Yeah, that's possible because based on the information tagged on the blockchain, you can find out the expired date, the manufacturer, and all kind of the content inside the medicine. Yes, so this is possible.
Okay. So I think it basically is a ledger, right?
Yes.
There's online. So whatever's in the ledger, you'll be able to take it, and it's a secured way of storing information, I guess. Okay, so we have another question talking about what's the liability of online medical advisors?
Maybe I'll take that. Okay, I would say essentially we are not the best person to answer that. Probably a legal team will be the best. But as far as I know, for online medical advisors, I would assume will be things like Doctor Anywhere or White Coat. They're all regulated by MOH. So which means to say that all of the doctors behind the screens are all certified doctors. And I guess because of telehealth, there's limitations when it comes to actual, physical examination. So I would say that if these doctors actually suspect that the patients probably has some underlying issues that is probably not, very obvious through the phone, then they have to then, refer them to an actual health institution like the hospitals or polyclinic for further investigations, and they will probably not be giving them any MCs, for example. So I guess although we do advance in terms of telemedicine and telehealth, there is those issues that still has to be more or less regulated, and I guess still has to be scrutinized to make sure that patient safety is still will not be compromised. Okay, next question. GDPR and other such data and privacy protection laws talks about mutable, erasable digital footprints, but blockchain talks about immutability. So how can we handle this conflict of interest? Wai Kin?
Yeah, I think probably we will need to see what is the content and also the information that they want to store into the blockchain. So depend on whether it's a health medical record or other information, then we can decide whether the data can be stored into the blockchain or they want to make it immutable. Yeah.
I guess I would say that when it comes to health data, I think one of the issues which we want to avoid is probably the tampering of medical health records. So I would say that every health institutions usually would have a whole team and a closed server where they actually archive all this information. So I guess the challenge, or rather the threat, with blockchain, that blockchain is trying to address here, I guess it's the tampering part. But when it comes to archiving and storing of that, I guess, blockchain itself has that secured ability to manage all these archival issues.
Okay, so we got a question from June on how secure the system in terms of data privacy and cybersecurity. I don't know, maybe this is more pertaining to say like telemedicine, teleconsult and such services, I suppose. In those cases, these channels are supposed to be encrypted. So by right, your whatever that you discuss with your doctors online will be on a secured channel. So therefore, it would be okay in this aspect. Yeah.
Okay, so probably something to add on. For Singapore itself, we do have this PDPA law. So essentially, every institution that collects any form of data has to comply with that measures that has been put in place. So while these measures are guidelines to make sure that every institution has some levels of security, it is not to say that it's definitely foolproof. So I mean, as we understand from the the SingHealth data leak, hacking was intentional. So actually, I mean, that is essentially something that is very, very difficult to deter, like when someone is intentionally trying to hack into your system. But I guess as much as possible, Singapore has quite a strict law with this kind of PDP issues, and there's a ton of guidelines that really instructs and gives a certain checklist for all these institutions to follow. So I would say that I mean, I'm pretty confident that most of the healthcare institutions are quite prepared, yeah, to manage all these data security issues.
I think there's a similar question around IoT, protecting data in IoT, right? But I guess in most of IoT devices, they are monitoring some kind of a metric, right? So like, what's your temperature, what's your SpO2 level, what's your blood pressure, things like that. So they're not transferring without having that linked up to your EMR, your electronic medical records, and put a name to it. Most of these data might not make that much sense to people. So I think that in terms of IoT in the case is actually okay. If you have anything else to add.
Yeah. So I take an example, let's say for Bluetooth mesh. So actually Bluetooth mesh embed with several encryption keys, such as a network key, application key. So with this kind of encryption, it might help in protecting the message transfer from one party to the other party also. Yeah.
Yeah, we have another question. Do we have AI bots for patients or relatives for queries on patient care instead of telemed? Anything right now? Yeah, you aware?
So sorry again.
So do we have any AI bots for consulting rather than? So as far as I understand, currently right now it's no. In order to come up with some kind of a AI chatbot, it typically takes a lot of training, having that kind of a script behind it. When you're consulting a patient, it can come in many different kind of varied ways. Whatever the patient might ask the doctor might be something very, very, very different. So as for now, I don't think we have an AI bot for that, but more of a telehealth, telemed, where you have someone that actually speaks with you.
Yeah, there's some mobile application which will ask you some questionnaires, and then the flow will based on the AI, and then it will give some advice for you. Yeah.
Yeah, I think maybe it's using some kind of screening,
yes.
Very, very basic things it will be able to answer.
Yeah.
But anything beyond that, yeah, I think...
Yeah, exactly. There's AI for triaging, but not yet for consultation.
What else do we have? What might be the upcoming or next big thing in healthcare analytics or digital transformation in Singapore? Maybe you can take turns to answer. What do you think is the next big thing? Okay.
For me, at least, I do see analytics playing a much bigger role, because I think nowadays, we really talk about big data and all that. So I think for health and social industry, they are catching on to this idea, and knowing that we collect a ton of different health records and health information, that is probably something to mine from, right? So I guess the next big thing that we probably might be able to see is some form of text analytics when it comes to mining all this data, because actual operations on the ground, it's nurses are still writing down the different conditions of the patients and writing down what has happened to them on a daily basis and all that. And I think they have already started transiting from manual recording to keying in onto the computer. Although it's a closed system, but I guess that's where a program can be built and overlay this health records, and then and essentially the medical informatics team can actually start to mine and possibly build towards creating that AI bot, to managing the patient's conditions in the wards itself. So that's probably something that we can really look forward. Although as to when that might happen, I'm not sure. Hopefully we do see that in the next 10 years, maybe.
Yeah, I think it really depends on what's the horizon that we're looking at. Is it going to be next 5 years, next 10 years, next 20 years, and what's realistic? So I think what's really exciting would be some form of a diagnostic support. So after you do all that text analysis and text crawling, right, then you might be able to start predicting that perhaps this person might be predisposed to some form of disease, and therefore alerting the doctors, so the doctors can then further investigate if this patient is truly susceptible to, say, maybe some kind of maybe diabetes or something like that, right? So that's something that's really interesting. I think with the current data, we are really startup companies are exploring, say, predicting the length of stay of patients directly at admission in the emergency department. So they are trying to come up with crawling the different matrices of patients that are coming in after they get triaged. They have taken some kind of vitals, and the nurses have typed in some texts. And they're trying to pull all these information together to try to predict, what's wrong with this patient and what might this length of stay be. I think it's only in time that these kind of predictions will get more and more accurate. And that will also help with the operations of hospitals. I think in terms of COVID, how has COVID changed digital transformation? I think the exciting part is now in the social setting as well. So more and more social services are going online. Can we, address things like mental health through digital technology? I think that's an open space that previously nobody really tackled before COVID. And after COVID, it became a big issue that's currently being addressed, but now it's still through people and people interaction. I see perhaps maybe things like gamification coming to play when it comes down to, say, mental health, for example. So I think those things are quite interesting places that perhaps next people can be exploring next. I don't know.
Yeah, I would think about the technology would help in reducing the manpower for the healthcare sector. So it will reduce the burden for the nurses, the healthcare workers. Yeah.
I guess one last thing to add, I guess, is in the spirit of digital transformation, it's again really not about bringing all this technology, but seeing how can all this technology integrate with your current business processes and business model in order to create that value. And I think that is probably the most important bit about digital transformation. Yeah. Okay, so maybe we take one last question.
Maybe we have an easy one. So does NUSIS have any data analytics course focused on healthcare? Yes, we do. We have data analytics for health, right?
Yeah,
so
health analytics.
Health analytics, yes.
Yeah.
So look out for that program. You might be find that interesting. Unfortunately, I think that's all the time we have for today. We will try to answer these questions online, perhaps via email if we can. There's a QR code on screen. Please do take a snapshot of that and give us some feedbacks for the talks I've been having at Learning Festival. Thank you so much for your time, and hopefully we'll see you in our classes. Thank you.